So we are in session 14. We are in Epidemics of Injustice, session 14 for this spring semester. And this week, we are focused on reproductive justice as a fugitive activity. You all know that we have been really navigating this journey of fugitivity, of conversations about disenfranchisement, conversations about freedom, and this conversation that we're going to have today really just follows right along with that larger course theme. So I'm going to go ahead and introduce the folks who y'all are going to be speaking with today, and then I'm going to get out of the way. We have Yoselin. Yoselin is a reproductive life planning coach at Cook County Health. She is passionate about reproductive and sexual health and ways in which advocacy, education, resource navigation, and health technology can aid and center community members' health. We have Mary. Mary has worked in healthcare for over 40 years, learning early that working in health requires a social justice lens. Her first involvement was at Chicago Free Clinic in the early 1970s, then at a Cook County community clinic, sorry. She's currently teaching in the UIC School of Public Health undergraduate program and is a board member of Chicago Women Take Action. Our next panelist is Shalonda, who is a mother of three beautiful girls. Her life goal is to be the best mother she can and to show her children how to empower themselves and others by living everyday life with purpose. She's currently a warm line advocate with Doula Community Alliance, advocating for laboring mothers, focusing on health equity within Black and Brown communities, a reproductive life planning coach with the Cook County Stroger Health Department, and a community advisory board member with ICANN. Finally, we've got Renee, our moderator, who is currently the division coordinator of family planning services at Cook County Health and conducts sexual and reproductive health research at the University of Michigan. She is an active member of Youth Reproductive Equity, which advances autonomy for adolescents through research and policy advocacy in the American Public Health Association, focusing her energy on policy recommendations. So you all know the drill, EFI. We are so excited to welcome these folks into our virtual space this evening. And while they are going and really just like dropping their reflections and knowledge on us, I want to encourage you all to be taking down notes and also, putting your own reflections and your own questions in the chat as they go. Our TAs will be gathering together those questions and reflections that you all share. And we're going to have plenty of time at the end of our session for questions and discussion about all that we've heard. So without further ado, I'm going to pass the mic to Renee, who's going to.
Thank you, Tiffany. And thank you, everybody, for having us today. Can you see my screen all right? Okay, great. So before we jump into the panel, well, I guess I do want to introduce our panelists for a moment. Tiffany read off their actual introductions, but I wanted to give everybody an opportunity to kind of introduce themselves if they wanted to say anything or add anything. Mary, do you want to add anything? Oh, you're muted.
No, I think I'll wait until you ask us the first question. That'll be plenty of introduction there.
Sounds great. Shalonda, Yoselin?
Same. I think she did a pretty good job.
Awesome.
Just echoing everybody. I mean, the discussion will kind of unravel itself.
Awesome. Okay, great. More time for questions then. So before we dive in with our fantastic panelists, I just kind of wanted to do some level setting for anybody who particularly is new to reproductive justice as a framework, but just so we can kind of get all on the same page as a topic first. So what is reproductive justice? At its core, it's the human right to bodily autonomy. This is coming from Sister Song, which is really who, developed the reproductive justice framework in the 90s. At the time, they were the women of African descent for reproductive justice, and that was here in Chicago. Oh, it doesn't want to. There we go. Okay. So reproductive justice is the right to bodily autonomy, and it's upheld by 3 pillars. The first pillar is to have children. The second pillar is to not have children. And the third pillar is to parent the children that we do have. So this is all kind of encompassed by safe and sustainable communities. So it's really that we can, do all of these things in safe and sustainable communities. And that to have and to not have is not about choice, which is sometimes I think how it can sound, but it's really about the systems that provide or more likely do not allow access. In our current political context, the reproductive discussion is often focused on abortion because of the restrictive policies that we've been seeing in the US. But the spectrum of care and support needed for reproductive health is much larger than this. So we need a full spectrum from STI testing and treatment, contraceptive access, abortion access, preconception care, fertility support, prenatal care, labor and delivery care, postpartum support, and family and parenting support. So our panelists today have done a lot of this work, but I really want to make sure that we're, rooted in the full spectrum of reproductive health. And reproductive justice, is much larger than that too. So it is awful that, Roe v. Wade has been overturned, but I want to be clear that Roe was never the end all be all for rights nor access. Abortions have been hard to get for rural and low income people, regardless of the legality. And focusing only on abortion, kind of as, we just talked about for the spectrum of care, is very, very narrow. So each of these aspects of sexual health can be and often have been criminalized. Pregnancy and parenting is criminalized through drug use policies. Contraception has previously been criminalized, kind of jumping off of the abortion criminalization and moral panic about sex. So all of these are connected to race and class, and this class's theme of disenfranchisement. So to have the care and the rights is not really enough either to really be able to realize reproductive justice. We would also need a just society. So in our panel discussion today, we will discuss abortion, but I really wanted to center us on the fact that we need to discuss pregnancy, prenatal care, contraceptive access, and broader sexual health, all of which are often difficult to access for women of color, low-income women, and people of diverse genders. So that's kind of it for slides. And now we can go to the panel. So now that we're all on the same page. I hope I'm not still sharing my screen so you can see us. Okay, great. So now that we are all on the same page, I'm really excited to hear from our panelists. So I have a couple of questions specific to each panelist's experience, but I do want to welcome all panelists to respond to any question that they're called to. But I do want to start with one for everybody kind of off the bat. We know a bit about your work from your bios, but I want to know what brought you to this work. Mary, what brought you to this work?
We can't hear you.
There we go. There is one thing I do want to add to my official bio, that I was one of the founders and a longtime board member of the Illinois Maternal and Child Health Coalition, which is now EverThrive. Okay, so I'm going to describe myself, but we're going to go way back in history because I'm pretty old and I've been involved in this for a long time. So right now, the work that I'm centered in is the struggle for human rights for all of us, which reproductive justice aptly represents through its pillars and its spectrum of care. So I grew up in an ethnic Catholic neighborhood, which is in Chicago, which is Westtown, which was pretty different in the 50s and 60s than it is now. My parents were working class. My mother worked in retail. My father had many factory jobs, and finally a good union job with the city when I was about 16. So that was great because until then our economic situation was always a little shaky. Unions are really good things. I went to Catholic schools and I actually believed the Catholic teachings of love your neighbor and that we're all brothers and sisters. In high school, I had some lay teachers that were like Catholic workers. And for those of you that don't know what Catholic workers are, they're kind of like, I would describe them, let's just say quickly, Catholic socialists. And they put a framework around my thinking about religion as a social justice teaching. I was the first in my family to go to college. I went to University of Illinois at Navy Pier, which was where the University of Illinois in Chicago was located then. And it's where my world opened up to progressive movements like SNCC, the Student Nonviolent Coordinating Committee, SDS, Students for Democratic Society, and the anti-war movement against the war in Vietnam. After Navy Pier, I transferred to Champaign-Urbana, where I became very involved in the progressive movements of the day. And I met an organizer from Chicago that came down to talk at a teach-in about the war in Vietnam, and he told me about an anti-racist organization that he wanted to start in Chicago that would organize white working class people in Chicago neighborhoods. So I said, I'm in, and I never looked back. We called the organization Rising Up Angry, and it was officially started in 1969 with the first issue of our paper. Paper proclaimed that we were committed to building a new world. And at that time, it's kind of critical to understand that there were a lot of movements going on across the country and in Chicago. For example, the Black Panther Party, the Young Lords Organization, the Young Patriots, and the Black Panther Party was probably the major organization that was going on nationally and certainly in Chicago. The Panthers were militantly anti-racist and against police brutality, but they also believed in serving the people. And they had served the people programs like a free health center, free legal program, free breakfast programs for children. And also they created and started a Rainbow Coalition, of which all of our organizations were kind of under that umbrella of a Rainbow Coalition. And our organization, Rising Up Angry, had a free clinic, which I ended up running. And I'll stop there and continue on when we get more involved in the legality of healthcare.
Thank you. Thank you for all the social justice work you've done. Shalonda, what brought you to this work?
I always tell people what led me to the work that I do is life and God. I've always wanted to work with women since high school. I had an OB-GYN. She was like the first Black doctor that I knew of that had her own medical practice located in Hyde Park of Chicago. Her name is Dr. Monica Moore. And I would go and do my work study hours with her and just work at registration. And I was like, this is something that I want to do. If I could have my own clinic or if I could just work with women, like this is my passion. So fast forward in life, in college, I still wanted to do like nursing and LPN program. I did so many things. And I graduated and started working with Catholic Charities. They had a Roseland Adolescent Parenting Program. From that program, I applied as a family support worker. But when I was talking to the director and she just heard my passion, she said, I had something better for you. So this role was a doula role. So in that role, I was still able to do the home visiting, but in a different space. I was able to see how people lived other than myself because I felt like I was more sheltered. So I wasn't able to see how life was for other people. I never like spent the night at anyone's houses because my parents were just like, no, you have to stay home. My mother was a teen mom. So I was very sheltered and locked in life. And so doing this work, I just saw how people lived and how they didn't know certain things. And being in the delivery room and in those spaces with them, how they were taken advantage of, because I work with adolescent moms. They were between the ages of 13 and 21. And it was almost what the doctor said is what's going to happen. And it was very disheartening almost for me because that's just couldn't be what life was about, right? I felt like your labor and your delivery should be something that you wanted it to be. So from there, it's just being a doula. I learned to just really advocate and teach my moms how to advocate for themselves. Just teaching them about having the right to consent and what not to consent to. So when they do go into those hospital rooms, they can make an informed decision on their care. They can know what type of medical interventions that they want, what type of medications that they want or that they don't want, who they want into their rooms, and have a delivery because they are the consumer. And then from there, I still wanted to work with families. So I'm here now at Cook County Stroger, but I'm on the opposite end. I'm doing family planning services, which still ties it all together. I feel like it's an extra bonus because now we're talking about family planning and trying to prepare so that we don't have as many unplanned pregnancies and that we can have healthier pregnancies and we can space, the pregnancies so that we don't have as many unforeseen health risks that happen, hemorrhaging and, hypertension, preeclampsia. So we talk about contraception and what that looks like. When do you want to start your family? And if they've already started their family, what does it look like? Do you want to continue or do you not want to continue? How's your period? So just educating them on those aspects of life, because we always think birth control is just to prevent babies, but it can just be how to just make your body work the way that you want it to in a way. Some people have heavy menstrual periods, right? They're bleeding all of the time. They don't know why, or they have fibroids, or they have endometriosis. There's so many things that occur in women's lives and we're unaware of those things. And so I'm in those spaces to kind of educate. And so, and I love it. And now I'm just able to talk more and make more connections. And I hope one day, with policy that one day I'll be in a space and I can help change policy and give my story or have a patient that I've had share their story. So that is just how I began to be in this field of work.
Thank you, Shalonda. Yoselin, I'm glad you're back. I know that you cut out there for a second, but I'm glad to see you. Just repeating the question in case that you missed it, but we know kind of a bit about everybody's work from the bios, but I'm curious about what brought you to the work that you do.
Yeah, so I think mine was a very like subconscious level of like getting into health. So I think I've been doing health since I was about 5 years old, I'm gonna say. So I think coming from a Latino culture and from parents that migrated to the States, I think it was very just like representative of, hey, can you translate this document to me? Can you come with me to the doctor? Can you do this? And I think in the community that we live too, the neighborhood, I think as soon as I started being able to drive, it was my neighbor, hey, can you take me to my oncology treatment, like appointment? Can you, translate for me? Can you do this? I think it was a lot of health that was influencing people around me, from diabetes to hemophilia to all these things that started kind of just surrounding me and being invited to like help out in a way. So I think it kind of started with just like that advocacy level of like helping those around me. It grew into continuing to again help those around me with like my grandpa getting open heart surgery and kind of translating a whole medical system from here to Mexico, to then just really at the end of college knowing that I wanted to do something health but I wasn't really sure, and I'm a very strong believer that reproductive and sexual health, that this niche kind of finds you. I don't think it kind of people that most people go into like, oh, I'm gonna work in this because sometimes it is thought about and sometimes it's not. But I think it really calls to you, and I think it takes like very special people to kind of do work in this in a way that's like kind to others. So reproductive health found me, and it found me when I came out to Chicago for an apprenticeship program. I started off with HIV and STI. So my home baseline is working in HIV, training people in community who are wanting to be community health workers to be HIV testers and counselors for the state of Illinois and Chicago. And then it was a very dual program. So it was also supporting people finding employment in these fields. So I think from the get-go, a lot of my backstory and work just has a lot of intersections with like different factors of health and health equity. So then from there, just fell into what was more of a focus right now with working at Cook County Health of women's and all genders, family planning and reproductive health. So kind of moved out from STIs and HIV, still very in the hub of it, but I think now with, birth control, just those milestones that are kind of marking everybody's reproductive health from, hey, when should you be going to the doctor for your pap smear, for your first mammogram, just kind of getting all those little milestones kind of done in the work that I'm doing right now. And just continuing to be very like intersectional with bringing DV work into this. Also a lot of cross section with like working in the LGBTQIA plus community in terms of the work that I've been able to advocate for and kind of continue to advocate. Again, to also in most recent, just continuing to serve my like migrant community and population. So it's a little bit of everybody come one, come all, and we will continue to find resources and help and advocate in the way best possible way that I can. And if I can't, I will 100% find someone who can help you better than I can.
Thank you. Definitely a through line for everybody really being committed to their communities. And I really like what you said about that, like this work typically finds people. Thank you so much. So, Shalonda, I wanted to tap on you, but I know that multiple people here have been doulas, so I welcome any responses after Shalonda's response. But Shalonda, what experience, how is your work, like how have you given that autonomy to the people and to the communities that you support and care for?
So, doing the doula work, as Dr. Davis was mentioning, I do a lot of education. So that comes from like doing parenting groups every Wednesday, just making sure that they can truly understand. So it's kind of like the teach back method. So I teach you something and then you just let me know what you learn type of thing. And then also taking them to like Springfield and letting them see what advocating for themselves look like, at a state level, things that they would never really see within the community. So that is something that I was able to do. And I was floored. Like it's just an amazing experience because a lot of like our community just does not have that. They put certain things in our community and take things away. We don't have sexually transmitted like seminars or education for like our kids in the schools, and everything is happening within the schools with our youth and they're not informed, and that's kind of where it stems. We have to teach them young, so that then when they're older they'll know. And unfortunately it's not that way. So if your parents don't know and if they're not taught, then they're not going to teach you. And so I'm able to kind of give them that autonomy back. My mom's, I'm like, okay, this is what you do. And my thing is, yes, I'm an advocate, but I want them to advocate for themselves. So when I'm in that hospital room, because they love to put doulas out, they don't really want us in there. I'm like, I need you to speak because they're not going to necessarily listen to me. I need you to be able to speak. And so I'm talking to families. So I'm making connections with mom, grandma, with boyfriend. And so if mom can't do it, then someone in their family can step up. And so I'm just appreciative of that information. And so that's how I've been doing it in this space. And as far as our family planning and contraception, it's a little hard because I do feel like I get a lot of pushback from like the physicians because they feel like they know what's best for the patient. And it's not what you feel is best, it's what they want. And it's process of elimination for me. We don't know how a particular medication is going to react with this patient. Yes, we know the common side effects and the common benefits, but I want you to let me know if this is something that works for you. Like you have to try it and then you let me know. And so I'm able to, give the patients that, so that they can feel respected, that they can feel heard. So that's just a little bit. I hope to, have answered your question a little bit.
Oh, absolutely. Thank you. I really like the example that you gave about also empowering family members, because I think that really like highlights the fact that, this isn't an individual thing for birthing, for any reproductive justice. It's, everybody in the family and the community, your partners. So That was really great. Thank you, Shalonda. Do any of our other folks who have doulaed on the panel want to add anything?
I haven't doulaed, but I've experienced having a doula on that flip side. So they are super important when it comes to being able to lead by example, I think. I think my partner, how Shalana was saying, like it takes another person to step up and take the role. My doula like laid out the land of how my partner could take over when she was no longer there. So I think their work is beyond important in how they're including not just the person who is pregnant, but who are the people, yeah, who's the village for this person. So just echoing that, like the work that the doulas do is beyond like just what is support. It's like fallen angels.
That was really beautiful. Thank you. Mary, I have a couple questions specific for you. I don't want to blow the lead, but you've been a little bit of a fugitive yourself by supporting the Jane Network. Could you just share a little bit about what that experience was like
Sure.
and how you got involved with the Janes?
Sure. Well, like I said before, I mean, I was involved in this organization, Rising Up Angry. We had a free clinic. And that's how I became involved in Jane, the abortion service, through my involvement in the free clinic. There were, like I said before, we're going to go back in history now. There were free clinics in Chicago then, but they weren't just free clinics. We were also building a movement at that time. So we had a free clinic and we would recruit neighborhood people to work in the clinic, to become patient advocates. And also we did a lot of outreach to get patients in. But when patients would come to our clinic, it wasn't like we were, shoving politics down their throat, but people knew that we had, pictures on the wall. We had the Black Panther Party 10-point program. We had copies of our newspaper. We had flyers about demonstrations and teach-ins that were going on around the city. So sort of with that in mind, that kind of framework, that we were really building a movement, and we may have to build that again in some way. But a lot of, we were a full service clinic. We treated patients with dignity, with respect, and we served everybody that came in. And a lot of women would be coming into the clinic for various issues, and also talking about how, they would get a pregnancy test and just not being happy if the results came back positive, and asking us if there was anything that we knew that they could do. So at that time, we had heard about this Jane service, which had started as kind of a word of mouth service at the University of Chicago. And that's mainly who it was serving, students and middle-class women. And the word of mouth was going around, and the need became so great. And we, the free clinics, were also experiencing a need from our patients. So we, and I'm sure the other clinics, free clinics, did as well, but I can only talk about the clinic that I was at. We made a liaison with Jane. We went and talked to them, and then we worked out that we would have one liaison from our organization and from the clinic that would connect with one person who was the liaison from their organization. And it was really a one-on-one because, again, this was an illegal activity. And so when we had women coming in, then we were able to refer them to the Jane service. And this was really important because it was either you were lucky enough to be able to find Jane, or you would have to take a risk with kind of a back alley abortion if you could even find one. And at that time, again, this was in the early 70s before Roe v. Wade, so it was before 1973. Um, Many women ended up at Cook County Hospital in the sepsis ward there because they would be so sick from an abortion and they were afraid to come in right away because they were afraid of the repercussions. So you had women that would be getting abortions that were botched and then would be afraid to go to the doctor because they were afraid that they might face repercussions. So, uh, okay, so then when we were with Jane, we started referring people to Jane. And again, the word of mouth was getting around, and they started getting other types of clients, not just middle class women, but working class women, diverse women, both economically and racially. And also women who could not pay the fee for the abortion that Jane had to charge. So they started a sliding scale, a sliding fee scale. And that worked really well for a while, but then they started getting women who really couldn't even afford that, who couldn't pay anything. So at that time, they thought that they had a doctor doing the abortions, but really, he wasn't a doctor. He had kind of, I don't know if he ever really lied to them or just the assumption was there and nobody ever challenged the assumption. He was just an abortionist that was very good at it. And so they figured, well, you know what? If he can do it, we can do it too. So that's when a lot of the women that were involved in Jane learned to do abortions. And really, abortions are not that complex of a medical procedure. So you can learn to do them. And really, they should probably have more people like nurse practitioners or midwives doing them now. So the women in Jane started doing the abortions, and the service really expanded. And they really were very caring. They treated people with a lot of respect. But again, even within that framework, it was illegal, and you still had to be blindfolded. They would meet you at a certain place, then you blindfold, take you to another place, then blindfold and take you to the place where you would eventually get the abortion. So let's see. So while all that was happening, Jane was becoming more and more, the women in Jane were becoming more politicized themselves, and they were getting more of a sense of social justice. I mean, they started out as just doing this as a service, but again, when they saw what the need was and how women really needed this service and how it really wasn't available to them, it wasn't a part of healthcare as it should have been. It's a part of reproductive justice, but it wasn't. They became more politicized themselves. And eventually, the women in Jane did get arrested. Some of them did get arrested. I think that it just couldn't be kept that secret because so many people ended up knowing about it. And they got arrested. And those women that were arrested were, out on bail. The service continued, but very, very much underground. And this was like right before they passed Roe v. Wade. So when they passed Roe v. Wade, they let the women go. And that was sort of the end of Jane. But by the time that Jane was over, the service ended like in 1973 when Roe v. Wade became the law. Jane had performed thousands of abortions, and they saved countless women's lives. And at the same time that all this was going on, women all over the country were awakening to proclaim their power. You had, women's liberation unions starting. You had the book, Our Bodies Ourselves. I don't know if any of you, Dr. Davis is shaking her head. Yes, right. We knew that book. That was sort of like, wow, women, our care, we're over medicalized. Our whole bodies are over medicalized, and that's
Mhm.
not what we need for ourselves. We need to take control of our bodies. And that was the women's, women just became to the fore and started proclaiming that they're going to take control of their bodies. We're going to look at healthcare as a totality. It's not just medical care. And we had that in the back of our minds. And it was when Sister Song came along, not too long ago, that it really got codified. So now, right after, I want to just say this, right after Jane ended and abortion became legal, along with what Dr. Davis was saying, we know healthcare is a business. It was a business back then. It's even a bigger business now. All kinds of abortion clinics started springing up in Chicago. And, okay, what's going on? People saw dollar signs and okay, let's open some abortion clinics. So some of the women in Jane and some of other women around the women's liberation movement started a healthcare evaluation and referral service called HERS to evaluate some of these abortion clinics. And the service was started. People would go in and take a look at them, take a walk through, and have a good sense of, is this place clean? Do they sound like they really are going to care about women? And women would call this service to find out, okay, is this a good place? Can I go here? Can I? And that lasted for a couple of years until it was more figured out. Planned Parenthood started doing abortions, and we knew that that was a good place. So right now, I mean, what's happening? It's we're in a very dangerous time. Of course, this happens. The excuse me. Why isn't that working? Huh. The I see. The Chicago Abortion Fund is having to cut back their services,
Mm.
as some of you may know. The abortion funds across the country, some of them are going to have to close, and a lot of them are having to reduce services because the need is so great. And also, we know that we're going to stop seeing money. That Illinois, our state, has been very good at funding and helping women from other states where abortion is illegal now. But when we in Illinois stop losing some funding, which we will, there's going to have to be cutbacks. And I guess that will be your last question, and we'll get to that at your last question. So I'll stop here.
Yeah, thank you so much for, the history that you're providing and contextualizing the moment. You yourself alluded to we might need a movement-based clinic again, and we need to probably be building a movement, thinking about how we're headed in a really dangerous direction when it comes to information. I'm really seeing this moment as like a moment of growing fascism. So I've been thinking a lot about necessary fugitive work, and it sounds like, kind of looking at the chat, it seems like a lot of other people are too. So Mary, I was curious why supporting the Jane Network was worth fugitivity to you, kind of as many of us might be faced with that choice.
Uh, it was worth it to me because we were involved in a movement, and it was a need of the women that would come in for healthcare to the clinic that we were running. That's why it was worth it to me to get involved with Jane. I mean, even though I wasn't involved in the service directly, we were a referral to the service, and we also did counseling for women who came in as sort of a quid pro quo with Jane because they were getting so overwhelmed that one of the things that the free clinics could do was to do the initial counseling for the women that wanted the abortion. So it was totally worth it to me, because that was part of the work.
a question that I want to take from the chat that Olivia posted, but so this is, kind of, I guess anybody, it's more future thinking. So, welcome to all of our panelists. But Olivia poses, is it even possible to do something like Jane again now with how surveilled we are? And there's kind of a little debate happening.
Hmm. Are you asking us?
Yeah, I am. Yeah,
I
I want
think,
to hear what you
yeah,
think, Mary.
I don't know. I mean, I thought of that, and what are we going to do? I mean, uh, I think there's a lot more surveillance now than there was then, for sure. I mean, we have the tech bros linking together all our data, and we're not sure where that's going to take us, although we can kind of guess that we're in a fascistic moment. And I think that we will figure out how to do things as they become necessary. I am pretty confident in that. I think that there are many people that we saw. I mean, based on there were, demonstrations across the country. Over 5 million people came out. So I think that, people will find a way to do what's necessary. I mean, I have a lot more to say about that, but I will at the end. But other people should talk now.
I think that's a really interesting idea if I can add to that. I think in a really wild world, I want to say yes, it is so possible. And I think that kind of comes from just knowing different people's skill sets, and just kind of how America works a little bit. So I recently had met someone who is a full practicing doctor in a different country, who now is practicing as a doula. And very jokingly, I said, "Oh, if you wanted to, you could, deliver babies in the back." Um, but it was with the idea that we have capable people with such specific skill sets that, whether they're from this country or a different country, that I think I don't want to say too much, but because it goes into my other question, but just like the collaborative of when you get people from different fields and experiences, I think some of those things are very possible. I think when it starts to get into the nitty-gritty of like, okay, let's also make sure that we're doing in the safest way possible, that we can, address certain things that could go wrong in this situation. If I was to deliver a baby in the back, what complications areas those things could be possible. I think it comes again with the thinking, how can we care for them beyond what we're trying to do at that moment. So yeah, just those big bigger thoughts and ideas.
Shalonda, do you want to add anything?
I don't know why my mind goes to the negative, right? It's going to, oh man, we've come so far, but at the same time, we're kind of still in this space, and I'm thinking of the repercussions, right? There's so many policies that has us colonized, right? About, the things that we can and can't do. We have naturopathic doctors and, it has to be in this state, or, you have to be certified and have a license in this state, or you can't practice, and just those repercussions behind that, yes, it could be done for sure. 100% it can be done. But I think what will be the repercussions behind that? Sorry.
No, that's real.
It's real. But I do think that, I have to say this, I think that it's really important that we think about how we're going to vote and how we're going to protect voting rights.
Yeah.
Just to bring it up to another level. Because if we don't think about that and do whatever we can, all the things that we talk about now, reproductive justice is not going to be, it's not going to be allowed, because they've pretty much made it clear that they want to get rid of things that talk about equity and that show the weaknesses in the system, in any system that we have here in our country. As of now, we will probably still be able to vote in 2026, but we'll see. I mean, they're already setting laws in place that are going to hinder voting, and I'm sure that there'll be more laws like that. So I think that we have to be watchful and cognizant of what's going on that higher, not higher, but on the overarching level of what's happening in our country.
Yeah.
We're in a different space now than we were, say, even 9 months ago. We are in a very different space. And, you know, Trump and the tech bros and the creators of 2025, they're simply out to maximize their appetite for greed and endless profits. And further, and this is really scary, they share on some level a philosophy that says that most of us are expendable.
Yep.
That we don't matter as people. We're here to work for them. I don't know if any of you know who Marge Piercy is, but there's a book that she wrote, and she wrote it quite a while ago, actually, but it was like prophetic. It's called He, She, and It. And it's about a corporate takeover of the country. It's really pretty fascinating if anyone has and it's also, you know, a good story. It's a good read. So if anyone has any time, I would recommend reading it. It's really interesting.
I have to add that to my list. One of my favorite books is a Marge Piercy book. It's A Woman on the Edge of Time, and it really radicalized me to see like how future societies could look. It's kind of like she's jumping back and forth in between the 70s and this like future world, but it's really about communities and community care.
Yeah.
And the way they operate is just like beautiful and really made me think very critically. Oh, thank you, Caesar, for posting that. Awesome. Thank you. Okay. Yoselin, I want to ask you a specific question. So you have, you know, kind of as you detailed, giving some background about your work, you've been at a lot of different intersections at health, and you've seen really firsthand how policies, societal factors, migration, and more have impacted the reproductive care here in Chicago. How do you connect kind of the conversation we've been having so far and, you know, talking about the history and everything with the current landscape here?
Yeah, um I think everybody said something that I want to touch on a little bit, but I think like the current landscape is just, it feels very heavy in terms of just kind of what's going on. So even from when you give something to one community, you take away from another. I think that is super real. I think I think from hearing community talk about seeing how the waves of new arrivals were coming to Chicago, I think we heard um, a lot of conversation of, you know, how are we able to service the new arrivals, yet in our own backyard, we cannot, you know, support the people who are experiencing homelessness in that case. Like, and I think those are just very real conversations from like what it is you're hearing from day-to-day people. And even as, you know, I think some conversations, you know, I don't know if anybody was surprised by certain people they work with or friends or family that are, you know, very pro this, pro that, you know, also kind of having these conversations where, you know, they're acknowledging that things are, you know, could be disproportionately given or taken from different people. So I think it's kind of just acknowledging like that yes, when you give someone to something, it will take away from someone else. And just kind of being really frank about what that means and trying to minimize the impact that it could have from who it is that you're taking away from. But even beyond minimizing, I think it's also just this big question of why not do it for our backyard too. Um, I think Olivia put something in the comments of like, what if? And I'm a very what if person. Thinking about like, okay, well, if we're doing it, why can't we replicate this? It's thinking about, okay, if Cuba and Switzerland have free healthcare, why isn't that we can't replicate this model? Like, what are the barriers that are making it hard for us to replicate things for certain communities? And I think again, it goes to something that Shalonda touched base on, like, the policies and these laws and these rules. And it is kind of like, okay, well, what if we didn't have that? Like, why is it that we have that? I get it to some capacity. But it is like these ideas of thinking bigger and how we can continue to serve Chicago, because we see in so many different ways from communities who are doing first responder work and going to do um clean serving oh, I forgot their name, but the Chicago Needle Exchange. But people that are, going ahead and providing these needle exchange and going to the community and providing those services firsthand. So I think it is just a very big way of maybe I think it is very financial to some capacity that we can't serve to our best capability, because we do have to have tools, we do have to have resources, we do have to have spaces. There's so much that we have to have. We saw with the new arrivals, just as an example, so many shut vacant buildings turned over to shelters or transitional housing spaces. But when we go through our really cold days below 10 degrees, sometimes we're not seeing those spaces open for other people. So it is a question of not fairness, but it's about what Mary was saying. It's like this concept of liberating. So it's a concept of liberating some of these services and resources and ideas that I think we're stuck to, that we have to do it um correctly or under the law. Not pushing at anybody to do anything, but I think there is these ideas that if we think about what if we were to do it a different way, that it kind of gets people motivated to work together. And I'm super huge. Mary was talking about connection, collaboration, groups. We have so many different groups. We have, yeah, the Chicago Fund. We have, I think, just mass, you can find something in Chicago for everybody in terms of mobilizing work. So I do think it's connecting with the people who are thinking in those lines of how can we work better together. Recently did a health education session where I've made a new community partner, and I'm doing my reproductive health information on birth control and cervical care. But I invited this organization because they can serve firsthand hepatitis C testing, syphilis, HIV testing, like a spectrum of 5 different tests that are all rapid. And what better way to get someone in care by, just having the service there on the spot. So I think that part is a really big thing about liberating resources, going ahead and making sure that in your work you're doing connecting, collaboration, and kind of, mobilizing with other work groups. I think that's huge. I think keeping in mind that Donna hit one of my biggest thing was knowledge. I think, one thing I wrote preparing for this was just sharing the resources, sharing the knowledge, and then building in community. And I think that just kind of encapsulates that we all need to know about it, and share it with each other, not gatekeep it. And that there is something for everybody to do in this work. And from Shalonda, I think she was big on support, and giving people the tools, and just, in her own like life, just teaching her daughters. I think it kind of goes back to like what are we teaching in our homes? What is going on in our backyard? Like making sure that we know what's going on, and how we can best like serve our, our daughters, our sons, our family members, our friends. I had a friend, and this is an example. I had a friend who her brother passed from testicular, can't say the word, cancer. Um, the young male identifying person was about 16. They had a twisted testicle, but they just didn't know that that pain was abnormal. And, as it progressed, it just got worse. And then they passed away from it because, it got too severe. But it's, our duties as a friend, son, daughter, mom, dad, person in a guardian to kind of teach what's going on with our bodies. And I think it starts from, teaching it in our home, teaching in our communities, knowing what's going on nationally and state, from knowing and taking the time with people. I think it's taking the time with people too, in terms of being able to share the knowledge, get together, and just kind of and keep up with, again, what's going on now and how can it best serve. So I don't know if that answered, but it is different to what is going on nationally, internationally, and then what's going on in our backyard.
Yeah, thank you, Yoselin. It is, everything is so, context and place specific. We all have our own, we've talked a lot about community today, and we all have unique communities. There's obviously things that transcend, but that was really, really great. Thank you. Okay, so I have one last question for our panelists that I prepared, but I've seen even more questions in the chat. So I'm going to pose it to you all, and then with whatever time we have left, I would love if we could kind of hear from the TAs what kind of popular questions were in the chat or sent to you all. So posing to the panel, as you all have provided and do provide reproductive care to disenfranchised populations, how do you see us achieving reproductive justice? What solutions?
I think Renee may have cut out, but just to jump in on her question, I think that's an open question to all of you on the panel. What solutions do you see available now or in the future, especially in this era of so much kind of darkness around us?
Darkness.
Maybe a strong word, but yeah, whoever wants to kick us off.
And it's a hard question to answer right now because we're in such a dark time. I guess you characterized it pretty correctly. We're in a dark time, and it's a hard question. How do you keep reproductive justice? I mean, how do you keep affordable housing? How do you keep anything that works well to enhance humanity? So I've been thinking about this a lot, not just for this class, but just in general. What do we do? I mean, I'm involved right now in an organization called Chicago Women Take Action, and but I think that we're coming to the point where we're barreling towards fascism. I mean, when they're picking people up off the streets for, no ostensible reason, we're not sure what's going to happen to us. And I don't want to be the prophet of doom, but I'm really thinking that we're going to have to create a big tent that is pretty wide and deep and that can accommodate people's differences. As long as we have a commitment to each other and to human rights and to ending the rule of fascism. I think, we're all going to have our own groups and our own organizations that we believe in and that will help us fight our best fight. But I think at the end of the day, we're going to have to marshal all these resources and come together, under a big tent to save reproductive justice, to save healthcare, to save, our own humanity. I was listening to someone I really like, Naomi Klein. Some of you may know who she is. And she talked about this woman she was listening to named Adrienne Brown.
Yeah.
And Adrienne says, is your heart beating? And do you plan to live? If so, let's come together and let's join to end fascism, and we'll figure it out on the other when we get to the other side.
Yeah.
So,
Yeah.
yeah,
Like I'm at a loss. I feel like sometimes I don't know. We always say it takes a village to raise a child, but what will it take to raise a village? Like that's
Mm.
the space that we're in. And I tell people all the time, like our community lacks so much. We kind of need to come together and have spaces where we're teaching one another how to write letters to like our local commissioners or representatives and, start small. We'll start trying to do some type of change, but we have to teach them, right? Because after so many letters and after so many people reaching out, in my mind, I think there will be some type of change, but we have to start small at the local level and then reach, to the state level and then the federal level. But it's just kind of scary because it's like, what allies do we have? Like, do we really know? But I just feel like that's a start.
Mm.
Mhm.
Yeah, I would just echo what everybody said, kind of been just building together. And just really trying to figure out what is it that we truly need. I think just not keep assuming what each community needs, but really kind of get down to the core of um, what is it that will make it work when we're identifying like what each organization needs and how we can each contribute to that differences and just not be afraid to want to work together. I think, as everybody's saying, I think there's a lot of we work very siloed sometimes, but it's just not be afraid to reach out to someone to want to know what is it that you need and what is it that I need, because you might have something that I don't have and I have something that you might not have. So really just kind of getting to the core of the needs too.
Yeah, thank you all for that. I love, the only way that we're going to be able to face this moment is to really band together. And Yoselin, kind of what you're saying is like also just asking people. I feel like we're often so afraid to ask, our neighbors or our friends for a favor. It feels like, oh, we shouldn't have to do that. But like to help people and be somebody that they would come to, you got to ask for help too. And Donna, I also really love that you brought up that Angela Davis quotes. It's one of my favorites because I think in addition to being good community members, we also have to be creative community members because we haven't lived in a just and equitable society. It's been pretty nasty. So we're going to have to be creative to create a new one. Um, Thank you. Is there anything that anybody wants to add? I know I kind of got cut out there when my internet cut for a moment, so I don't know if there's anything anybody else wanted to add, but I do want to make sure that we have some time for the student and community member questions. All right, Megan, Veronica, I don't know if you were kind of like collecting questions or if we want to use the chat or how y'all want to handle that, but it seems like we've gotten quite a few questions. So,
What are some key lessons from y'all's time in fugitive reproductive justice organizing that you want to share with with the folks who are newer to fugitive organizing of any kind within this current political moment?
Guess that is talking about Jane, which was a fugitive organization. I think that when we were organizing back in the late 60s and early 70s, we kind of really thought that maybe the revolution was going to happen tomorrow. And obviously, we learned that that wasn't going to be the case. But that gives you a little bit of an attitude that may make you less careful than you need to be. I think that if things continue to move on the level that they're moving now, there probably will be fugitive organizing. And I would only say that people that would be doing that would need to really be careful and pay attention and have a deep understanding that people in power now are not playing. This is real, and that you would have to be, be there because you're committed, and you're committed to really doing the work, whether it's reproductive justice on some level or whatever it might be. But I think focus and attention and understanding that this will be fugitive and everything that means.
Thank you.
Um,
So my bad. Go ahead.
oh no, no, you're fine. I'll make it quick. I'm not sure if like fugitive also falls into like the people that are new arrivals and kind of with like the seeking political asylum and everything, but in terms of like the work that I've noticed was really meeting everybody where they're at and kind of have sensitivity to the work. Not everybody's going to open up to you. That's very real. But you will hear stories of their journey over here. And I think just being able to go ahead and there's a lot of little things that go in place for making sure that you are able to communicate in that language, being able to go ahead and know that you might have a hard time like reaching them and that a streamline of communication is important. So if you're not a person that can get to them, you know that maybe there's that caseworker, that social worker, that person on site, that some people are gonna actually, you're also not gonna be able to serve everybody. Some people are just kind of Chicago's a pit stop for them and they're going elsewhere. So just kind of knowing that your work might not be able to get done and be okay with that.
Right, and it all goes into like I don't know if you ever heard it's the tale of like the mustard seed, right? So you can only plant that seed and you may not always see it grow, but later down the line it may. And you may, get to see what that looks like in the future. It's not going to be in an instant. Things take time. Change is going to take time. So I think we have to think about that too.
One thing I also want to add is I feel like I definitely don't have as much organizing experiences like Mary. So I really, appreciate Mary's perspective on this. But in the years that I have been organizing, I kind of feel like I've been in two types of groups. And, not some groups do better at balance than others, but I feel like there are groups that lean like really political analysis and like they want to talk about the politics and read a book all the time. And then there's like groups that are like so like brass tacks, we're just doing the, activity that we're talking about. And I feel like both are important and like being able to balance like what's our ethos? Why are we here? What are the politics behind what we're doing? What, brought us to this work? Like balancing that with the actual work that you're doing is like where I've found my sweet space, my like happiness, like my cups being filled up because I'm giving back to the community, but I'm also, like connecting my political and societal analysis with the people I'm doing it with. Like I think you just need both and to find that balance.
Mm.
I would just add that political education was a hallmark of the movements in the 60s and 70s. So it was
Yeah.
both. You were organizing, but you were also learning and, learning from other movements around the world and from other people in your country, from philosophers like Marx, etc.
Thank you all. Just taking a look at the time that we have remaining, I want to invite all of our speakers to just like, if you have any sort of final reflections or like thoughts that are on your mind related to this bigger topic of reproductive justice as a fugitive activity, related to this topic of people coming together to ensure that they have what they need to be well, to have children, to not have children, to parent their children. Like, I just want to open the space for you all's final reflections.
Well, I know I'm a panelist speaker, and but I feel like I learned so much from today. Just trying to give a little information from what I know, but it's so many things that I don't know. In my mind, I'm thinking about like, ooh, how can we run free clinics? We have them, but everything is run by some type of money or some type of form. But to keep things going. So like in the ideal world, we want these things, but how do we really truly keep these things going? And, how do we get into these spaces where we're just kind of like meeting people to get there, having these different ideas and discussions. It's truly like mind blowing. And I thank you for having me. I learned so much from you, Mary, Yoselin, today. Some things that I haven't even, thought about really. And I'm sorry for the baby in the background. It's part of the reason why I haven't spoken so much too, because she's just making so much noise. But and that's the reason why I do it too. I have children and I want them to be able to live in a world where they're gonna be okay. We've come so far. I feel like family used to be so close knit. And as I'm becoming an adult, I see how we deviate and we're so like disconnected because we begin to have like our own families and stuff like that, and it's just so embedded in the community. We it used to be where we were helping one another. We were, our neighbors were watching, and your grandparents were watching the kids, and we've just kind of lost all of that. um but thank you guys.
Yeah, same. So I would say I would say the same thing in terms of just kind of um going ahead and just my little one too now just crawled up into the room. But um I would say just being able to think big. So I would say think big, and I think even in the capacity, I've thought big at work and ideas get shut down all the time. But it is 100% okay, because there's a lot of people that are, yeah, a lot of people that are like-minded. Um, so in that capacity, you will find someone else that you can connect. And I think I'm so big on just being in organizations and involved in community. I think that's the biggest change maker to like mobilize. So think big, like-minded people. You will get shut down, but that doesn't stop the work. Um, and in terms of just like keeping in mind that reproductive health and sexual health, in a lot of communities just isn't talked about. So, I want to teach about the body to any little human that I know. And I want to keep teaching to even the adults that don't talk about it. And I want to challenge the ideas. So I think just don't be afraid to ask, and just always be open to learn, because there's so much in this field. But I would just say just keep thinking big, because we're all here in today because we all want to go ahead and keep doing this work.
I would just say that Shalonda, Yoselin, Renee, I think you're all blessed to work at a place like the Cook County Health System, to work in the public sector where it's not solely for profit, even though county had to join the real world and figure out how to make some money. But I think you have great opportunities there to really think about the reproductive justice work that you're doing, and to really do it, as I've heard from you all, as well as you possibly can. So I want to thank you all for the work that you do. And yeah, I think it's important to have the big picture, and it's also important to do the day-to-day work like you all are doing. So thank you.
Thank you. I love to hear that. I love when the speakers, of course, the speakers show up in this space and they always like offer so much insight to those of us who are like receiving the information. But I love when it seems like the speakers also leave with something as well. So just thank you again to all of y'all for being in community with us this evening. And I hope you can see folks saying thank you in the chat. Somebody sent a message to me directly, which I think they might have meant to send it to the whole group. They said therapy time. So I think also just we receive like information for like, I don't know, our brains, but we also receive a lot for our hearts as well in these spaces. I'm gonna share my screen real quick. I know we're a couple minutes over, but I'm just sharing my screen to again say thank you to our speakers for this week. And to invite y'all to give them a hand clap, show them some love in the chat like you've already been doing, but also to let y'all know to please join us next week where we will be talking about healthcare as a fugitive activity. I'm dropping a bunch of links in the chat right now. One link is to make sure that you register for the class next week. Another link is to our post-course evaluation, and then the other link is to our 2026 interest form. So thank you all again for being in community with us this evening, and I'll see y'all next week.